Yo, it's about to go down. I said, yo, it's about to go down.
What's going on, YouTube? What's going on? It's your boy Steve Belcher with Urban Health Outreach Media. Thanks for joining us this evening. This is going to be a great broadcast. We have done many shows on anemia, but now this is an Anemia 2.0 for YouTube. All right? Share this broadcast. We need 50 people on this YouTube page. I'm also have a Facebook Live from my personal page. Hey guys, what's going on? But yes, tonight we're going to talk about just the facts, anemia and CKD, right here on Urban Health Outreach Media, right after this PSA intro. All right. What's going on? It's your boy Steve Belcher with Urban Health Outreach Media. Thank you for tuning in to Kidney Disease Education Moment special broadcast. We're going to be talking about anemia and CKD, right? Because let me just say this. Anemia is a very common condition for people with kidney disease. Right? So if you just got recently diagnosed with kidney disease and you feel fatigued and you go to the doctor and they say your hematocrit is low or your hemoglobin, that's common. And so they may, even before you start dialysis, you may experience this. And so they'll give you what's called EPO shots, but I want to show you how it looks like, but we're going to go into it, but I want to show you a picture of how it looks like. It comes in a little bottle like this, right? That's the EPO. So if you suffer from anemia, you're a kidney warrior, 9 times out of 10 you're getting EPO shot. So let's get right into it. What is anemia? I mean, we all know people say I have anemia, and they normally say low blood. But what is actually anemia instead of low blood? I mean, let's not just walk around and say I'm anemic, I have anemia, which you probably say I got a low blood count, but what caused it? Do you know what caused the anemia? Or the doctor just told you have anemia, or you may assume that. But if you're a kidney warrior, 9 times out of 10, you may have some form of anemia, suffer from it. Nothing wrong with it. It's a common problem with people with kidney disease. And it can be controlled. That's the magic thing about it with that medication that I put up on the screen. But again, let's look at what anemia is. Okay. So anemia, let's go back to a little bit of scientific stuff. So every part of your body needs oxygen. Every part, right? Red blood cells carry the oxygen through the body. Your red blood cells, that's how the oxygen travels throughout your body, goes down to your feet, to your digits, to everywhere in your body carrying oxygen. Even to your heart. That's why, have you ever heard of the phrase someone having an ischemic attack? You know, like a myo infarct, like the heart attack, because the muscles to the heart is dead and it's not getting the oxygen. People with too few red blood cells have anemia. So I want to show you a screen. So this is, well, let me turn you around, guys. So this is what anemia looks like. On the left, right, you have normal red blood cells. You see these multiple red blood cells. And then on the right, anemia, you see you got less blood cells. You can tell a difference, right? So again, on the left, you got normal. And then on the right, you got anemia, where you see the less blood cells. These are the blood cells right here, these red ovary things. You see where it says red blood cells? Then you got the platelets. That's how the platelets look. And then your white blood cells. Now, how many warriors contend with this? White blood cells. You know what I'm talking about. They say your white blood cell count is low or it's high. That's how they look like. Right? That's how they look like. If it was inside of you was looking in a microscope. All right. So let's move on. What caused anemia? You may hear people say, again, I'm anemic. And you may not even know. You may just say that and may not even been diagnosed. How many people know people say I got anemia and you haven't even been diagnosed for it? Maybe you get cold like really fast or something like that, and you put it upon yourself that you anemic. But what causes anemia? People on dialysis often have anemia because they lack a hormone. See, when your kidneys fail, they stop producing a hormone called erythropoietin. That's the hormone they talk about. That hormone goes or signals the bone marrow to reproduce or produce more red blood cells. So when your kidneys don't make the erythropoietin, that's where this guy comes in. EPO, right? That's erythropoietin synthetically. That's the hormone in that bottle synthetically, which is man-made. So that's what a lot of warriors get each treatment 3 times a week. They charge about $1,000 for them shots. Look on your bill. Look on the bill. You see the EPO shots. I had a lot of warriors tell me, man, that they like really taxing them with that EPO. But I want to share some stuff about that, right? I want to share the game. Good evening, whoever tuned in. Shine, how you doing? Thanks for tuning in. I'm going to give y'all the game, the EPO game, how that works. So, again, what causes anemia? People on dialysis often have anemia because they lack a hormone called erythropoietin, which I just showed you, or EPO for short. EPO is made by healthy kidneys. When your kidneys are healthy, they producing the hormone erythropoietin. It's sending the signal to the bone marrow to produce more red blood cells, and that's happening. But we don't even think about it because we're going about our daily life. So you don't think about stuff like that. Not until it hits you. Not until kidney disease creeps into your life where all this comes about. And that's why we're trying to educate. So you know, EPO is made by healthy kidneys. EPO tells the bone marrow to make more red blood cells. Now, if your kidney's not working and it can't produce the hormone, how is it going to tell the bone marrow to produce more red blood cells or make it? When your kidneys fail, they no longer produce EPO. They no longer produce it. Without enough EPO, there are fewer red blood cells to carry oxygen in the body. How many warriors have been diagnosed with anemia and you can feel it, like when your blood count is down? There are other ways, though, that blood is lost, right? That can cause a person to be anemic. Iron loss. I had somebody on here, who was it, on my live. Hey, Candy, Jackie, Martin, Lena. Lena said she gets iron. Well, you know why Lena gets iron? Because iron is lost due to blood loss or some other indication that cause iron not to be made. Some blood is lost when needles are placed and removed and in the tubing. Now, let me ask you this. If any warriors watching, I got my man Greg watching. He used to work in dialysis. And he's on dialysis now. But he'll tell you, Greg, if you're still watching, give me a thumbs up if I'm right. Or how many warriors had their blood discarded? I mean, the whole tubing, dialyzer, blood still in the tubing. They telling you, oh, your blood clotted. We can't give it back to you. Give me a thumbs up if this happened to you. If you were on dialysis and you had a treatment and halfway or somewhere before your treatment ended, right? Your machine went off, and the next thing you know, all your blood is in the dialyzer, right? And in the red and the blue line, and they tearing it down, throwing it away, and you looking at the side of the chair like, what the hell is going on? And somebody telling you, oh, your blood clotted. We got to change the dialyzer. How many warriors experience that? I know I have, as a charge nurse, seen it, right? And if that happened to you, right? Or if it ever happens to anyone on dialysis watching this broadcast, you make sure, I don't care where you go, DaVita, Fresenius, DCI, what's that? Oh my God, tip of my tongue. US Reno, any dialysis clinic, where you ever may go. I don't know overseas what's the rules are, but in the United States, wherever you watch and wherever you go, if they ever, and I mean ever, have to stop your treatment because they had to throw your blood away, like the dialyzer and this, before the treatment ended and you didn't get your blood back, make sure that they write an incident report. Make sure, or you write one yourself. You know, you go home on this day, my treatment wasn't completed, or midway through the treatment, my blood was discarded. It wasn't returned because it clotted. And then make sure that they draw a hemoglobin or hematocrit on your next treatment. I kid you not. I've seen this many times. Oh my God. Oh my God. Guys, oh my God. This is my attorney. I got to take a pause. Jesus. Oh my God. I missed that call. That's all right. Wow. Okay. Sorry about that. So, again, if they throw your dialyzer away, the tube and with the blood, right? You make sure they do an incident report. You make sure they document it in your medical records, because a lot of techs don't do it. They just throw it away, set it up, and it's business as usual. But I say that to say that you can lose blood through that as well, a large amount. Just imagine, it's about 2 cups of blood, I believe they say, that goes through that filter at any single moment. So some blood loss occurs in surgery. If you're in a hospital and you have surgery, you can get blood loss. Blood is also taken for labs. So you got to make sure you preserve every single ounce. All right, every ounce. And so you may not know this because you may have started dialysis and no one explained it to you. You just know you get EPO 3 times a week for your anemia. I'm telling you, because that's what I used to say to the patients. I used to, when I get ready to inject the medicine in the lines, I say, Mrs. So-and-so, I'm about to administer your Epogen. It's for your anemia. You get 3,000, 10,000. Let them know. And they like look at me like, oh, I didn't even know I get that. Thanks for telling me. I'm looking at myself, scratching my head. You didn't know you get EPO? Wow. So again, that's why this education is very, very important. And that's why it's important to share and let other people know. We're not charging for this information. Again, and those who watch it who don't know me, before I keep, oh my God, Maria Berkeley, God bless you. Thank you for tuning in from Richmond. For those of you who don't know me and just watching this broadcast for the first time, my name is Steve Belcher. I'm a dialysis nurse. Have 2 master's degree, one in leadership and management and the other in health education and promotion. Been doing dialysis 33 years. Been injured on the job, and God has landed me right here to start this this mission, and everyone else that's part of this group, Urban Health Outreach Media, to do what we're doing now by doing these shows and educating. So again, why is anemia important to you? Right? If you got kidney disease, why is anemia important to you? Let me tell you something about anemia. And I know a lot of warriors would tell you they've had many blood transfusions. That's why you have a lot of people with kidney disease that's on the transplant list, right? They're hard to find a donor because their antibodies are sky high, like Superman. Their antibodies are sky high, And it's hard to match because maybe they've had multiple blood transfusions. So this is important. Anemia can reduce your quality of life and increase your risk of death. Let me repeat that. Anemia can reduce your quality of life, reduce the quality of your life, and increase your risk of death. With anemia, you feel tired, you have less energy to do things you enjoy. Come on now, how many people watching this broadcast had less energy or they feel tired after dialysis and even days after? And then when you come to find out, they do the blood test and the dietitian or your doctor comes and say, Mrs. So-and-so, your blood count is low. And you may want to know, how did that happen? It could have came out through your stools. Yes, GI bleeding or gastrointestinal bleeding in your stomach for kidney patients is common. How many warriors, they give you the GUIC test, that stool card, right? And they give you the little stick that come with it. And they tell you, after you take a bowel movement, take a piece of the feces and smear it on the card. Close the card up, put it back in the bag, and bring it to dialysis so we can see if you got blood in your stools. Yes. Less oxygen, right? With anemia, less oxygen reaches your brain as well. If you got anemia, you got less oxygen going to your brain. So you may not think as clearly. How many warriors say they suffer from brain fog? It's a lot of things that can cause that, but here's one: anemia. Not just high urea, but also anemia, because you got less oxygen going to the brain and other parts of the body. Even if you're diabetic and say you have a wound, right? You have an open sore. And if you're not managing your anemia, that means you got less blood going down to that wound to promote healing. That's why they say, what's your protein level? What's your albumin? That all ties in. If you have a high albumin level, you'll feel better. Healing will be promoted faster. But if you got an infection, you just get out the hospital, you don't eat, no appetite, anemic, it's going to be hard to recover because you got to get that protein and albumin level up, that hematocrit or hemoglobin. Then it says, again, less oxygen reaches your brain, so you may not think as clearly. You may be less able to fight off an infection. Hello, we're talking about COVID-19, anemia, diabetes, hypertension, CKD. That's a mixture for disaster. That's the ingredient for disaster. If you have CKD, whether you're on dialysis, pre-dialysis, transplant, you're anemic, you're diabetic, and you have hypertension. Now we got the COVID-19 to worry about. That is a mixture for disaster waiting to happen. People with anemia are also more likely to have heart problems because oxygen is not getting to the heart. Do you follow me? Do you see the pattern? You see the pattern. That's why heart disease and diabetes is tied together. And you know why that's so? Because the same plaque, right? That same arteriosclerosis, the fatty tissue, whatever you want to call it, the cholesterol, the fat, whatever you want to call it, that same mess that's blocking the artery so oxygen can get to the heart, right? That same fat is coating the cells, right? To prevent the sugar from getting in, to prevent insulin from putting the sugar in the cells. That's why they call it insulin resistant. How's it going to get in the cells if it's coated with fat? So what it does, it builds up into the system, causes your A1C to skyrocket up, thus diabetes. You can't pass diabetes down. Not unless you're born with type 1, with a defective pancreas. Right? That's why people who have type 1, they got kidney disease, they suggest they get a pancreas kidney transplant. Why do you think they don't recommend getting a pancreas kidney transplant with type 2 diabetes? It's still diabetes, right? Diabetes. It's either type 1 or type 2. Type 1, you're born with a defective pancreas. Type 2 is brought on by your dietary. And if it's your dietary, what's likely in the ingredients that's causing the diabetes? It's the saturated fat from the chicken, the beef, animal protein, the products. It ain't cotton candy and sodas. What that does, they're high in sugar, and it just adds to the problem when you've been diagnosed, because when you got that fat, you see a lot of people with diabetes are overweight. They talk about that BMI. Why do you think they talk about that? Because of the fat that's in the belly. This is about anemia, but I'm just showing you how all this is all tied in together. And then they make the medications to treat it. Like the statins, to reduce the cholesterol. You're not born with high cholesterol unless you got some defect. You created the high cholesterol with your diet. You know what I'm saying? So now they're giving you medicine to decrease it. But while they're giving you that medicine, you're still eating the same foods that caused the problem in the first place. You see the setup? It's like a merry-go-round. You go to the doctors, you've been diagnosed or your cholesterol is high. Let me write a prescription for you. All right. You write a prescription, no education, maybe some education, right? He may give you a list of foods to eat, come in a little, maybe a fact sheet like this, right? You take it home and throw it on the counter. You go get the prescription and you continue to eat the chicken box, the same stuff that caused the problem. You go back to the doctor. I need my prescription filled. He may give you like 5 refills, and you keep repeating the same pattern. But where you could just Stop eating the foods that cause the problem. Get off the medication. I mean, guys, this is the biggest setup in modern history. I'm telling you. So again, I said people with anemia are more likely to have heart problems because they can't get oxygen to the heart. Oxygen can't get to the heart. Men with anemia may be less able to have, now, this is true. We all adults. Men with anemia may be less able to have erections. That's why they got the Viagra. You see how all this is tied in? Instead of fixing the problem, right? Let's look at this. Look at this setup. You got high blood pressure, right? Maybe have kidney. Well, let's just say you got high blood pressure. Say the blood pressure medicine that they prescribe to you cause you not to have an erection, right? Now, instead of, right, fixing the high blood pressure, controlling it, changing your diet, right? You still continue on that pattern and you still take the medicine and you go to your doctor and say, look, I can't get an erection because the medicine, after I started taking this medicine, I can't get an erection. All right, let me write you a prescription for Viagra or Cialis. Instead of saying, look, control your blood pressure so we can get you off the medicine, right? So you don't experience it. Or they may say, okay, that's happening. Let me prescribe another blood pressure medicine for you. Now you're taking one medicine for your blood pressure, another one to maintain an erection. When at one time you was never taking any. But because of your food pattern, now you're in this situation. So with women may have changes in their menstrual cycle with anemia. Children with anemia may not grow as well. How is anemia treated? Here we go. Now, guys, this is what is how anemia is treated with epogen and iron, but we're going to talk about epogen. So normally, a lot of patients don't see this box. The nurses, we get this box in the back in the medication room. There's 10 vials in a box, and this is a 20,000 units per milliliter. So let me just show you this. So this is a milliliter right here. This vial, this is 2,000 units per milliliter. So that box I showed you would be 10,000 per milliliter. So for each milliliter, you got 10,000 units, or in this case on this screen right here, 2,000 units per milliliter, right? Now, so a patient may get, say, 3,000 units. We'll take one of these vials out and withdraw 3,000 units from that vial, right, and administer it to you. So EPO, this helps the body make red blood cells. My bad. Iron supplements in conjunction provide the building blocks for red blood cells. Your iron level must be adequate for epogen to work. All right, so again, that's Epogen. That's the box it comes in. They comes in small vials, as I showed you. Each vial will contain 10,000 units per milliliter. Sorry. Lord have mercy. I got to turn my camera around. I don't know what's going on. All right, there we go. Man, I don't know what was going on my phone. Sorry about that, guys. So that's how anemia is treated. How is anemia measured? How do they measure your blood count? That's why we do have any warriors watching, see them take those purple lavender tubes. We draw your blood like twice a month to see what your hemoglobin count is or your hematocrit. That's how we measure it. A blood test called hemoglobin measures the oxygen carrying protein in the red blood cells. Again, a blood test called hemoglobin measures the oxygen carrying protein in the red blood cell. A blood test called hematocrit measures the percent. So it's two different ones, right? The hematocrit measures the percent of red blood cells in the blood. The hemoglobin measures the oxygen carrying protein in the blood. All right, two different ones. So in the National Kidney Foundation, it's called KDOKI. I'm not going to get into that, but it's like a recommendation on what your target hemoglobin should be. But they recommend that your target hemoglobin level should be between 11 and 12 milligrams per deciliter. A hematocrit, if you want to measure in percentage, would of 33 to 36%. And normally what they do to measure that or to get that is they measure 33.3 times 3. Yeah, 33.3 times 3 to convert the hemoglobin to the hematocrit. But they on the labs, they show you. So you ain't got to do no measurement or try to figure out what your hematocrit level is, because on the labs they show it. But this is what Epogen, it comes in the package, recommends. They insert a target hemoglobin between 10 and 12 in a hematocrit range of 30 to 36. Now, let me tell you, that's probably changed because this material, which is still prevalent, is from May 1999. That's how long I've been, I've been around a long time, but from this book that I got when I worked as disease management, there you go, look at that, 1999. So I've been in the game, a long time, 33 years, but I'm just giving you information that still pertains today. They still give you EPO from 1999. It's 2020. So let's talk about how you can avoid. I got to take this call, guys. I got to take a break. Wait a minute. Hey, Mr. Matz. Okay, that's no problem.
about to go down. I said y'all, it's about to go down.
What's going on? It's your boy Steve Belcher. Sorry for the interruption. I truly apologize. But my attorney called, so I had to answer my attorney's call. I tell you, boy, when you dealing with a Fortune 500 company, such as myself, in a workman's comp case, man, yeah, absolutely, man. So look, how can you avoid anemia? Say the problem is you feel tired. How can I prevent it? Hey, Sylvia, thanks for chiming in. Thanks for watching. Pastor Gregory, Arlita, Jim, Kertisha, God bless you. Miss Kathy, Aaron, and Claudette, and Larry. How can you prevent feeling tired? Well, if you know what your target hemoglobin or hematocrit is, or your family member, discuss it. Discuss your target hemoglobin hematocrit with the dietitian or the doctor. Get involved with the treatment. Discuss your symptoms with your doctor to see if there is another cause for your fatigue. If all of a sudden your dad, your mom, hey, Rolanda, you yourself, if you're on dialysis, if you felt great 1 week and you don't have no flu or nothing else, and all of a sudden you start feeling tired, and let's just say before that happened, they threw away your blood because it clotted on the machine, or you had some blood loss through your stools or something. It could be that your hematocrit or your hemoglobin dropped. And now you got to discuss and let them know. Don't just walk around being mad or feeling tired and don't say nothing. If the staff don't ask you, because at the least, the nurse is supposed to come around each treatment and do an assessment on you, right? See what's going on. If they're not doing that, then you need to tell them, I don't feel well. I need to do something. So, investigate it. Again, discuss your symptoms with your doctor to see if there is another cause for this fatigue. Be sure to get as much iron as your body needs. Let me tell you something. If you first start dialysis and your iron is low, they may have you on ferrous sulfate, which is iron, right? And a pill. But the side effect of ferrous sulfate in the pill form is constipation, right? And so that's why they like to give it IV inside the clinic. Some people get constipated, some don't. If you get constipated, definitely try Miralax. Come in a purple bottle. So why should I ask? I'm sorry, what should you ask the team or your doctor? Ask them what your target weight is. Oh my God. Ask them what is your target hemoglobin or hematocrit. Again, even if you never heard of it before this day, if you never paid attention to your labs, if your family member or anything, I encourage you, go in on Monday. I don't even get my days mixed up. I'm thinking it's the weekend. Go in tomorrow, Wednesday, and just, if you don't know, if you never heard of it, or if your family member of a kidney warrior that does dialysis, if you never heard of hematocrit or hemoglobin, and this is the first time, I encourage you tomorrow, if you see the doctor on the floor or the charge nurse, dietitian, say, what's my husband, what's my wife's, or what is my hemoglobin or hematocrit right now? Or ask them what is your target. Ask them, are you getting enough iron? Because I've seen people's iron level go low. The doctor only comes around maybe once or twice a month. I don't know. And this stuff gets falls through the cracks because if you got shorter staff, you got nurses or the dietitian that looks at the lab results and make adjustments based on the lab results. What if they sick and no one adjusts the lab? Then who's going to know if your iron is low? I've seen this many times. So if you don't know that your iron is low, and the dietitian and there's one nurse and everybody's busy and no one's come to you and say that your iron is low and you've been feeling tired for a month or two and no one discussed anything about iron or your hematocrit, how would you know? What foods have iron? You should be asking that. What can you do if my hematocrit or hemoglobin is at the target level and I am still tired? Do I need IV iron? My hemoglobin goes up and down like a roller coaster. How many warriors experience that? 1 minute they tell you your hemoglobin is at 8 or 7. The next thing you know is at 11 or 10. And then it's back down to 8. And then back up to 12. Ask your doctor how your dose of Epogen and iron affects your anemia. Exercise. Exercise to build stamina and to raise hemoglobin and hematocrit levels. What should you ask? Can my Epogen dose be changed or given more often to make my hemoglobin more stable? Do I need to receive Epogen by injection rather through the tubing? How much should my hemoglobin hematocrit change each month? What kind of exercise can I do safely? Now, let me tell you something, guys, with this medicine. And I said I had something to tell you how they, this game they do. So, with Epogen, say, okay, we do the labs to check your hematocrit hemoglobin. If your hemoglobin level, remember I said that they want the range to be between 11 and 12, right? Your hemoglobin. So say if it reaches up to 12, right, or over, or anywhere in between 11 or 12. Well, if it goes over 12, they stop the EPO. They stop it. You don't get it until your hematocrit drops back down. And then and then what they do, they reduce the amount that you were getting prior to that by 25%. So you'll get a lesser dose. So it's like a seesaw, right? 1 minute you could be getting 3,000. The next minute you could be getting 5,000. So if your hemoglobin drops, right? Say if it drops between 9 and 10 or between, a certain level, then they increase it. They increase the dosage. So you see how they play, how it's seesaw? So if your numbers go up past 12, they stop it. And when your hemoglobin starts to drop and decrease, they restart your epogen at a lower dose that you was getting before. How many people say been on dialysis watching this, and you say, "Oh, I was getting epogen one time, and now the nurse come and they're not giving you epogen." And you be like, "What happened? I thought I was getting epogen." Oh, your blood count is up, and we stopped it. And then next thing you know, 3 or 4 weeks later, here they go with a new dosage. Yes, that's how it works. So I think and you should also take a renal vitamin every day. Yeah, it is, Martin. That too plays a big factor. That too. And also, guys, you can eat some protein to build up to help with the red blood cells, like chicken, fish, beef, fresh pork, tofu, eggs, turkey are high in protein. I don't really like, talk about animal protein because, again, that's saturated fat. But I mean, and sometimes you do have to have something that has that high protein intake, or do, vegan diet as well. I'm just going to read this right quick, and then I want to end the program. Other causes of anemia. Other causes of anemia. In addition to EPO and iron, a few people may also need vitamin B12 and folic acid supplements. Oh, it's a multivitamin for renal patients. If EPO, iron, vitamin B12, and folic acid all fails, your doctor should look for other causes such as sickle cell disease or an inflammatory problem. At one time, aluminum poisoning contributed to anemia in people with kidney failure because many phosphate binders used to treat bone disease caused by kidney failure were antacids that contain aluminum. Y'all remember back in the day when I started, like in the 80s, right? I started in 85. And I remember people were getting dexferritin, or had this filter which got the iron out, or gave iron. Wait a minute, I'm sorry. Let me back up. It was for aluminum, right? But it was a medicine that had it, and we used to give it. I can't think what it was, but they write at this. At one time, aluminum poisoning contributed to anemia in people with kidney failure because many phosphate binders used to treat bone disease caused by kidney failure were antacids that contain aluminum. But aluminum-free alternatives are now widely available. Be sure your phosphate binder and your other drugs are free of aluminum. Anemia keeps people with kidney disease from feeling their best, but EPO treatments help most patients raise their hemoglobin, feel better, live longer, and have more energy. And that's the truth. I mean, that man-made epogen definitely does wonders. In fact, y'all, it does so much wonders. Lance Armstrong felt like he needed to use it during the Tour de France, or however you want to call it. So if Lance, I mean, and plus, well, now he also had cancer, so that's not a laughing matter. But what I was just making light of is that after he was healed from cancer, in remission, that he continued to use this sports enhancement or Epogen to get an edge over other cyclists. And that's the part that I raised laughter at, but not the fact that he may have had to use this medicine to treat anemia due to cancer. So, guys, thank you for watching on YouTube. Thank my one guest watching on YouTube. Thank the 9 people that's watching on my live. Love you guys. Thank you for your support. I always know I can count on at least my one person on YouTube. All right. And my people who come on Facebook Live and support me. So, guys, thank you so much. Again, we're going to keep doing these broadcasts until the wheels fall off, because we know this education is widely needed. It is. So, hey, you're welcome, Denise. Thank you for tuning in. God bless you, and stay safe up wherever you're. New York, stay safe up there, please. So with that being said, everyone have a good evening. Oh, and let me just say this. We're going to be doing a lot more shows, meaning the education shows on YouTube. And we're still going to do the shows that we do, the 5 shows, Lisa Baxter Show, World Kidney News, Warriors Quest, Urban Reno Talk with Tamika and Steve, and Kidney Story 2 with Uncle Jim. That's still going to be on the Facebook Urban Health Outreach Media. The one thing that's going to change, however, is the kidney disease education moment broadcast. They're going to be strictly on YouTube. That's where you can catch it, or you can catch if I do a live like I'm doing now, you'll be able to see it. But other than that, for the kidney disease education moment broadcast, they will be coming from YouTube. We got to build our platform up on YouTube. And so we'll be doing a consistent live broadcast, probably every Tuesday night at 8 o'clock. You can catch Kidney Disease Education Moment. I said it right here on YouTube every Tuesday night from 8 to 9 p.m. Thank you guys for watching YouTube. God bless you guys. Please support, subscribe to our YouTube channel. We need all the support we can get, guys. We surely do. Also, if you're watching on the live, this Friday is going to be the first of the Urban Kidney Alliance patient and family virtual support group, where you're able to come on live broadcast and share your story, experiencing hope, not just by yourself. It's going to be 4 people with a facilitator and a co-facilitator. And we're going to have a topic that we're going to talk about. Hey, Elaine, God bless you. Hope you're staying safe. I'm on here on YouTube broadcasting. So this group is going to be really great. It's almost going to be like a NAAA support group, that kind of concept, where you're able to share anything you want to share, whatever you've been impacted by kidney disease. Or if you're just having a bad day and you had a bad day at the unit or at home or at whatever, you'll be able to share it right in the group. And that group is a closed group. You can find the group, but it's closed, meaning the broadcast and the sharing is strictly limited to the group. And confidentiality is the utmost cardinal sin, is confidentiality and anonymity. You don't take what we share in the virtual support group and go into another group and say, I heard this or someone shared that. That is cause for immediate ban, like on what's that show? Survivor. Yes, like Survivor, you could be banned from the island. Take your clothes and leave. But no, I'm just making a little light of it. But no, guys, we take confidentiality, anonymity very seriously, especially when you're talking to someone, when you're trying to build a cohesive group of people that deals with the same condition, and you try to establish trust. And that's the last thing you want to do, is go out and take someone's information that they felt that they wanted to share, and they felt like they had the trust of the group, and to be violated like that. I mean, nah, we don't want that. So yeah, guys, again, can't wait till Friday, 9:30 to 10:30 Eastern Standard Time. Start the group off. We're going to just give some few house rules and housekeeping stuff like that. Got a preamble, group preamble. So it's kind of structured, not structured where you have to do anything. But again, the only requirement for membership is being impacted by kidney disease. And if you refer the group to somebody, please just make sure that they're impacted by kidney disease, and tell them that you're referring them, and please just tell them to answer the questions. It's only two, have you or someone in your family been impacted by kidney disease? And the second question, how many years how long have you been impacted by it? And then we have the group rules right there, and acknowledge that. And then you end like Flynn, and it's just a group to, especially in light of what's going on, to give experience, strength, and hope. Because someone may have dealt with a situation one way, and now a warrior is dealing with that same situation and doesn't know how to deal with it. And maybe somebody in the group dealt with it, and it can guide them through, push them through that process, or share their experience about transplant and what happened. I mean, we're not going to sugarcoat anything in this group. No sugarcoating. I mean, the truth is the truth, whatever it may be. And that's where we come together as a cohesive unit, camaraderie, unity, trust building. So when the hard time comes, right? Because they will come for some people. Some people may want to give up dialysis. How many groups you've been in that you heard people wanting to give up? Right? Wanting to give up. But let me tell you something. It's no different like an NA group. AA group, whatever group, whatever your vice or addiction one may have, and participating in these groups. You don't have to be alone. All you have to do is reach out. You know, that's what we're here for. You you be a sounding board for someone. We check up on them. Let they know you care, or we care for them. We're gonna promote the I when you're talking about something. I experience. Don't say we need to do anything. I need to do something. Not we, because we could be doing it. What about you? So we try to use language like that in the group as well. So we have nothing but good intentions to try to navigate people through this hard time with this coronavirus and any anxiety, depression, or any mental illness. We're not no professional when it comes to mental health professionals, but we are clinicians, and we can't talk about things in a group setting to navigate and to recommend outside help if you feel you may need it. But this group is just particularly, again, for people impacted by kidney disease, and you want to share your story, what the topic is. Say this Friday, we're going to be talking about CKD and the family. Has CKD impacted your family life? Have the roles reversed? Meaning, did both people work, the husband and the wife? Now the wife can't work because she got kidney disease, or the husband can't work because he got to go dialysis. Now it puts more pressure on one or the other. Now it's stress. The income. Well, maybe somebody experienced that same thing and started something where the wife and the husband created home income, work together instead of being frustrated. You never know. You never know. So this is the type of group that we looking to create. It's already created. We look forward to having you. If you want to be a part of this dynamic group, again, it's Urban Kidney Alliance Patient and Family Virtual Support Group on Facebook. Thank you guys for watching. Again, sorry for the interruption from my attorney, but I had to get that call. I really do. He's in Baltimore. I'm in DC. And with everything that's going on, I definitely had to get it, but I promise you, I will not let that happen again. And I would just continue with the broadcast and have my phone on silence. I forgot to do that. But again, my apologies. Thanks for watching. God bless you, and have a great evening. Stay safe, stay blessed. And again, good night and God bless.
Y'all, it's about to go down. I said y'all, it's about to go down.